So we thought we could take New York's and adjust it a little bit, and wrong. So we put together an amazing team, which included Joanna and Scott Brown. Scott here? And students and other architects, planners, health professionals, community activists, and started to develop our own program. And by the way, you can download the publication at activedesignmiami.org, and we do have some here today, right, Jess, for sale?
Yes.
Just $5, help us pay for printing. Why active design? And we're just gonna, we haven't rehearsed this at all, but we've done it a few times, so we'll just team tag or something. This quote I thought was really important for architects to think about. Obviously that's where my great interest lies in design and architecture. And architects are public health workers, and I think now, even more so, are they beginning to understand that, and you'll see from presentations from Gensler and from Stantec today the kind of things that are going on in the country with architecture and health and public health. So what is active design? Does anybody here not know what active design is? Cool. So we'll skip that. And this is why we think it matters. It influences our behavior and our health. Everything that you do, unless you live under a rock someplace in the middle of nowhere, the built environment affects you and affects your day, affects your life. And as architects, planners, designers, elected officials, city staff, it's our responsibility to make our communities as healthy as possible.
So just to add to that one, because in Miami-Dade County, we're in a unique situation. If you imagined an evil genius sitting around saying, what can I do to make people's life really difficult? And you'd say, well, what do people really need to be healthy? We need to see each other, we need to move physically, we need to have access to green, to daylight. So you immediately start peeling those away, right? So you'd say, oh, let's put everybody in little machines so that they never see each other walking down the street because they're machines. And let's take all the places that they have to go and put them really far apart so they spend a lot of time getting to them. And when they get there, they're in a really bad mood. And then let's teach architects that buildings are these wonderful objects that should be experienced in beautiful photos, right? And let's give architects awards for that. And let's tell architects, forget about all those things you learned about, making life better for people. And then you would kind of have created the world that we have today. But it wasn't an evil genius. It was really a grand experiment that did not go well for us. And in Miami-Dade County, people are suffering. And I think it's really important to understand, like when we did this, we were looking at, so we know that access to green, social interaction, physical activity are absolutely essential to health. We know that the more you have of these things, the greater longevity you have, and we also know that you have a healthier longevity. So if we understand this, how do we go about doing it? And how do we look at Miami-Dade County? So when Cheryl started the process, we said, well, let's take a snapshot, and this is where Valerie and the DOH are really helpful. Who are we in Miami-Dade County? Right now, today, in Miami-Dade County, 1 out of 4 older adults suffers from depression. Right now, and that's one of the highest rates around. The national average is like down 12%. Right now, in Miami-Dade County, 34% of the older adults do not have health insurance. So right now, in Miami-Dade County, we have statistics on obesity, depression, heart disease, stroke. And our environment, if you look at the little chart of what makes us healthy, 70% of the things that affect our health are the places that we live, people that we see, the life choices that we make. we know a lot about genes, but the fact is, two people with the same genetic profile in different environments have different outcomes. So I just want to underscore when Cheryl says, why does it matter? It's really a matter of life and death. It's a matter of the quality of life. And the reason that architects are the public health workers, like we all are, like what we've learned is that we all have to take responsibility for the environment around us because it's shaping us. So based on that, and then I would just add that the guidelines then came from the research. Like, this is what we know. Okay, then what can we change? What can we affect? And New York didn't need to deal with sprawl. And as you know, we do.
And the original guidelines from New York were developed like 9 years ago. So there's been a lot of new research, and really their initial guidelines only really dealt with obesity. And so we added these other areas of mental health, and you'll see in a minute the way that we set this up. And we worked with the Center for Active Design in New York, which is an organization that was developed out of this process of the city creating these. And this was something that we did with a grant and help from the Florida Department of Health and the CDC, but New York, the city paid for it. And they got some other grants as well.
Mayor Bloomberg. Yeah.
So, you know, as we mentioned a little bit, collaborative approach was really important, and that's kind of my mantra all the time anyway. If this isn't, the best things are done with collaborations. I can't do them in silos.
And just to add, the reason why you're being here today and this collaboration is so important is because the department that funded this at the CDC doesn't exist anymore. So we could not do this today. And I think that you know, the responsibility has kind of come to the local communities, and your role is.
It's very important because we don't. Our grant is over. So we're trying to continue to move this forward as much as possible, and you know, looking for constant ways to fund this. But this is I'm not going to let this die. This is something that is really, really important to me, and I'm going to make sure that I continue to work with all of you. I hope we have new ambassadors here for active design as well. So these were our 5 guiding principles, and you know, as you're looking at, like, where do you start with something like this? If we're starting from scratch and we're not just copying over what another place has done, how do we direct it? And we felt it was important to come up with guiding principles, and those here. And because, as I said, I'm a tree hugger, sustainability was one of the most important things to me.
It should be understood it was an inclusive process. There are people from all the municipalities, there were people from all different fields, and multiple groups, and sifting through to say what is most important and critical. And we felt number 1 was at the top of the list, because some people separate and they'll talk about mental health as if it doesn't affect your physical health, or physical health as if it doesn't affect your mental health. And so we said, let's take a different view of health. Health is not the absence of disease. Health is well-being. And then when you understand that, well, then you need safety, inclusiveness,
And yes, we had her. So these were our 4 areas of opportunity: parks and open spaces, development patterns, which is something that New York did not have at all, and we thought was crucial, transportation and mobility, and buildings. And so we're just going to quickly go through sample strategies. What?
I'm just looking at the remote, waiting for him to go into action.
Oh, we got plenty of time. And also we worked with, and you'll hear from Miami-Dade Parks, that we work very closely with Maria Nardi and her staff, and they're doing some really wonderful things that you'll hear about. So some of our sample, we had, just to reiterate, 69 evidence-based strategies. So some sample ones, to be inclusive, to accommodate all ages and abilities, incorporate amenities to support comfort, facilitate waterfront activation. One of the things that we felt was lacking is, yes, we have an amazing beach and an amazing bay, but we also have a lot of waterways in some of the neighborhoods that are far away from the east side of our county. And there's no access to water, especially in a lot of underserved neighborhoods. And we're promoting the idea of street ends and pocket parks and street ends and ways for people to activate those areas so that more people can have access to water. And which, in my opinion, because I think I'm a Pisces, so I'm water-oriented. You know, water is so important. And this was a project, the water fountain, this is Margaret Pace Park. It was a project that was one of the Miami Foundation's Public Space Challenge, and we're hopefully we'll be seeing more of those around the county. And I know that in Miami Beach now, whenever there is a park renovation or a replacement of a water fountain, we're putting in not this particular one, but something similar to that, so that everybody has access. There's even a little place for doggy water. And the most important thing is they're refill stations, so you don't have to keep buying plastic bottles of water, and you can use your refill bottles. Then development patterns. You want to talk about that?
Yes, because well, we live with these development patterns, right? And you can look at your own life and understand how the time that's spent commuting, and also just the distance that happens. When you walk down the street and you see someone, it would not occur to you to be rude or to, you know, ask them what's wrong with them or to think ill of them. You would just say hello, you'd walk on. But when you're in a car, it's really quite natural to think ill of the people around you because they're not going through the stop sign, or they've got their phones, or they're just not connected. So one of the things that happens is, in order for us not to have to drive everywhere, we have to have a mix of land uses. This has required some reconsideration of county zoning, and we had a lot of zoning people at the table. Transit-oriented development, this is a seriously big issue. The ULI, the Urban Land Institute, just did a retreat resilience location. We had a conversation about work they did at Arch Creek, because we, in addition to everything that we're talking about here, we have a kind of chronic condition of sea level rise. So we need to be thinking about how to deal with that. One of the ways they suggested was looking at the FEC rail, because it's some of the higher ground. Henry Flagler always picked the best property because he got a mile square of it from the state of Florida for free for bringing the rail down. And so they have really a great location, and they said, well, why don't we focus all our development related to potential transit? It's on the high ground, and it connects people, and you don't need to be using cars. And then if that development is mixed use, and it emphasizes pedestrian connectivity, because it's one thing to say, oh, I could walk over there if it weren't for the canal and, you know, the 6-lane road. And then parking requirements. If we could walk more places, if we could use transit, if we are using Uber, if we are eventually going to have autonomous cars, we don't need so much parking. So if we do build parking, then maybe we shouldn't do sloped floors, because it's kind of hard to live on a sloped floor unless you're a permanent skateboarder. And then finally, preserving housing affordability. This is another issue, because we have this in Miami-Dade County now. In an older community, you would have had a mix of housing in neighborhoods. Grand houses on one boulevard, smaller houses behind, and smaller houses facing smaller, and then at the corner stores. And you see this in places like Paris. Nobody thinks a corner store in Paris is a destructive force in the neighborhood. And so we said, well, okay, let's start thinking about ways that we could integrate that housing doesn't need to be segregated by cost. So this is just the sample. There are lots more of these. We could talk about them for a long time. But the fact is that don't think to yourself, or we ask people not to think, gee, it's already built. How are we going to fix it? And we looked a lot at Galina Takieva wrote a number of years ago. Caesar knows this book, Sprawl Repair. And she looks at how do you actually go in and fix neighborhoods. So our goal is that we not only, thank you.
I'm getting the signal.
Our goal is that we not only are looking at this when we build new places, but that we're looking at this when we could fix existing neighborhoods. So these strategies are, the sprawl strategy, the development patterns can happen, and they encourage infill. And it's happening already. I think it was Andrew Fry at a panel talked about looking at properties in Little Havana and how you could actually sponsor and support infill. So there was an Eastward Home movement too. So there's a lot of stuff embedded in this, but it's basically we need to be closer together, we need to be able to walk more, and we need to have more greenery and data.
And at the same time supporting density.
Yes.
And another little minor example is in the in downtown Miami, we're building residences without parking.
Right.
But the code in Miami for bicycle parking is directly attributed to how many car spaces there are, which makes no sense. So if you're building without a car, without a garage, you don't have to put bike parking in. So we're working with the city of Miami to help them change that ordinance. It's kind of been on the back burner with them for a while, but I'm going to start putting the pressure on again, so that bike requirements are connected to square footage or number of units. So those are the kinds of things that we're working on in terms of implementation. Next, transportation and mobility. One of the best things and the top recommendation is to support and implement complete streets. And does everyone here know about complete streets? I think so. You're pretty... No? Okay. So.
Okay. Well, so the idea. First of all, if you don't have Victor Dover's book, I'd highly recommend it, because Victor Dover and John Massengale did a book on a complete street. A complete street means streets are not just designed for cars to go as quickly as possible, which really, if you talk to people who are transportation engineers and they were trained a while ago, they were really looking at maximum speed so that you spent as little time as possible on the street, right? So if you look at our streets out there, streets are designed in a way that cars can go as quickly as possible, which means that people and bikes are not safe, which is why Florida has one of the highest rates of pedestrian and bicycle fatalities in the nation. So there's an effort to say we need to come back now and we need to take a look at our streets and we need to redesign them in such a way, because we've got plenty of room in them, so that bikes and pedestrians and children and dogs and elderly people are safe on the streets.
And transit
and they include opportunities for buses and access to transit.
And you see around the county there are, and one of the things that we promote is demonstration projects. If your community is worried about implementing something, ask them to do a demonstration project, and usually they're happy with that afterwards. We have a Complete Streets demonstration project on Southeast 1st Street in downtown Miami. There are others going on. The county has developed Complete Street guidelines, and they're working with different municipalities that don't have their own to implement them. And obviously there's a cost, and it's not something that can be done immediately. But I think that your elected officials need to hear from you that this is something that you think is important, and they can put funding for that as a priority. And if any of you have driven on the Venetian lately, you'll see that the bike lanes are now painted green, which really, I used to think, how much difference does paint make? But it makes a huge difference. I believe that they should be protected, that we should have stanchions, or, I think that that's the ideal. But the green paint does make a difference. And also on Key Biscayne, they're adding it. So that's happening around the community. And I'm finding it in different, like I'll drive down the street and there all of a sudden the bike lane is painted green. So since I drive the Venetian every day back and forth, I really have noticed that the cars are paying more attention to the cyclists because of that paint.
Yeah.
So. And then buildings. Buildings are an area where we can do the most for active design, and it's not rocket science, people. And it's something that you can incorporate into your practice very, very, very easily. Now, this picture is one of our favorite examples. It's Planned Parenthood in New York. Now, I know that fire-rated glass is really expensive, and it's not always easy to get a client to, spend the money there. But look at that stair. Isn't that wonderful? I mean, nobody is going to not want to take the stair when it looks like that. maybe make the stairs in an area that you don't have to search for them to find them. And one of the things also that we're going to start working on, hopefully soon and with some of the communities, is to look at, I'm not going to go into, for those of you that don't know what FAR is, it's floor to area ratio, and it's how they decide how big a building can be. It's the simple way of saying
Except
it, right?
for unless you're in Miami 21.
Yeah, okay, that's a whole other conversation. So we're working to maybe make stairs not be included in the FAR so that developers are more likely to let you put a monumental or a more active stair in. So those are the kind of things that we're looking at.
But it doesn't, if one is in a building where there is a stair and it's not used very much, it doesn't mean you have to walk away. Like, I know as architects we tend to think spatially and three-dimensionally, but signage has actually been shown to make a difference. And I was working with a healthcare system that put signs in the stair that were like encouraging signs. Congratulations, you did the stairs, kind of reinforcing. And what was really amazing is the CEO said that they had a problem with elevators and conflict over the elevator timing. That went away because people were using it. So he didn't actually count who was using the stair, but he knew that his elevator problem had gone away. So you can't dismiss the impact of sign. And there are also messages, there's a whole science to the messaging of how to encourage us to move around. But I would also add this, having broken my leg and not been able to use stairs for a while, and all of active design is like, of course you use the stairs, and then people give you kind of a look like, why aren't you using the stair? I think it's really important to make these spaces inclusive, so that if you're with someone who is on crutches or in a wheelchair, that you can kind of be in the same spaces. Because the one thing that happens is when these things are all separated and not connected, it affects the social fabric. So there's a lot to think about, but signage is
really important. As a matter of fact, we did a program for City of Miami planning staff to talk about active design and implementation strategies and things that they were doing already. And if any of you have been in that building, the not City Hall, but the office building, the stairs are hidden. It's impossible to see them unless you're really, really searching. And we talked about ways to fix that a little bit, and they have since developed signage that talks about, here are the stairs, and if you take it, this is how it's going to impact your health. And more people are using the stairs now, so it's as simple as putting a sign up. So how are you going to use these strategies? Obviously, it will inform design projects and planning projects. Work with your elected officials and your planning and zoning staff to look at shaping local policies and plans. Thought leadership is really important, like getting Commissioner Lago on our side. When we started the process, we went to both staff and to the elected so that it came from both directions. And out of our, and inspire community action, and that's why we've been doing Fit City, because we hope that will happen. We have been, since we started, we have 10 municipalities that have adopted active design as a policy, and the county. So just to let you know, 24 to go. Right now, I'm just working on implementation with those 10 because, unless I get another big grant.
Because Miami-Dade has 34 municipalities plus, Miami-Dade County itself, and it's really important that but we are a region, geologically the water's flowing under all of us. These boundaries are not, they're social boundaries in some cases, they're economic boundaries, but they're not real boundaries. So I think this is really important. The other thing, though, in terms of using the strategies, one of the things is all of the strategies are based on research evidence. Like, we looked for serious evidence that proved that this particular action had an impact. So if it helps in the process of design to be able to talk to someone about why one is suggesting this, not just because we think it's a good idea, it occurred to us the other day when we were walking our dog, but in fact, because there's proven evidence that it impacts health, it impacts productivity, it impacts employee retention. So there is a lot of really good material that's
Yep.
embedded in the strategies that I hope people will find useful.
Absolutely, and if you go to our website, activedesignmiami.org, you can download a copy of the strategies. Like I said earlier, you can get one of the soft cover books from us that we have up front, and I think that it gets the thought process going. So thank you, Joanne. So let me call up our next panel. Carla, you want to come up first and introduce your group? Carla Valdivia, AIA, Christopher Adams, Shannon